that's one of the goals of my podcast, is to educate and empower consumers to be in
Yeah.
charge of their own healthcare.
Be your own health authority. The
Right.
word authority, like I was saying earlier, we were raised, I think before we went on air, we were raised to question authority in my generation, probably in your generation, to question authority. And the word authority comes from the word author, right? To write a story. When somebody's writing is your authority, they're writing your story. When it's part of your life, that's one thing. Or if it's your, legal authorities or political authorities, that's one thing. But when it's a health authority, that's especially egregious. You don't want to let somebody else write your health story. That is a dangerous position to be in. That's a dangerous position for the individual to be in, because, as I said earlier, the job of our institutions here in this country especially is to make money, is to make profits. So our institutions that we trust to take care of our health, they're really not necessarily there to take care of our health. They're there to make sure that the economic interests are maintained. So even an organization like the Food and Drug Administration, there's the whole revolving door phenomena where the heads of drug companies end up being working for the Food and Drug Administration,
right,
or lobbyists end up working for the Food and Drug Administration. And it happens in other parts of the government as well, the defense industry in particular. But when it comes to our health, there's nothing more egregious than somebody who's pretending to be advocating in your interess, but who really has something, someone else's interest in mind, or another interest in mind. But here's the thing, Shawn, I don't like blaming somebody else. This is up to us as
Absolutely.
individuals. Yes, it's true that there are interests that are arrayed against our interests, but we don't have to listen. We don't have to participate. You don't want to abdicate this very intimate part of our lives, which is the health of our bodies, to an outside force, because if you do, you're going to be, there's no way that your interests are going to be maintained. And we see this. We have more doctors, and I don't want to rip on any individual doctors. This is a paradigm we're talking about, a model. But we have more healthcare professionals, medical healthcare professionals in this country than ever before in the history of man. We got more medical devices. We've got more medical diagnostics. We've got all kinds of insurance. We've got all kinds of hospitals. We've got so many drugs. I don't know, thousands of different drugs. People are taking 4 to 5 billion prescriptions a year. People are taking. We are so medicalized, but at the same time, we're the fattest. We're the most cancer-ridden. We have the most diabetes. We're the sickest culture in the history of mankind at the same time as we are the most medicalized. Clearly, there's something wrong.